Now, measles was declared eliminated here in the U.S. 25 years ago thanks to widespread use of the measles vaccine, seen as a historic public health achievement. But before that, take a look at this New York Times headline from 1989, when the last significant measles epidemic ravaged Houston, Los Angeles, and Chicago. Measles, not yet a thing of the past, threatens a vast resurgence in '89. Well, fast forward to this headline yesterday from the Times. Do you need a measles booster? So are we going backwards? Let's bring in Dr. Vin Gupta, pulmonologist and MSNBC medical contributor. Doctor, before the vaccine, millions were dying globally. Tens of thousands were being hospitalized here in the U.S. That last major outbreak in the late 80s saw 123 deaths. Is it possible it could get that bad again?
Well, Anna, good morning. The concern here is that in places like West Texas, we're seeing, you and I were chatting about this earlier, 20%, up to 20% exemptions for the childhood measles vaccine in those places. And so, yes, I am worried there'll be pockets in the country that will be at very high risk for measles outbreaks and hospitalizations. And just to emphasize a point that Sam brought up in his excellent reporting, it was one of the biggest forms of misinformation when Secretary Kennedy said that kids were being hospitalized for quarantine purposes. That's not happening. We've spoken directly to the Lubbock, Texas a spokesperson at the Children's Hospital caring for these patients. They are there for pneumonia. And so for all the parents out there that are watching, that have loved ones perhaps in the region, severe measles causes severe pneumonia. It is a respiratory viral illness in its worst form, Anna, and I think we have to be very clear on that.
So going off the New York Times headline there, I wonder, do American adults need measles boosters given this outbreak?
Yeah, and so this is where I'm going to try to boil it down as clearly as possible. So the going thought here, and the questions I get a lot, is why before 1957 is it assumed you're good? Well, the idea there is that you were likely naturally exposed. Measles was endemic. But what I would say is for anybody that was born before 1957, because you're older, I would want you to get a measles titer. So make an appointment with your primary care provider, get a titer if you have any questions, or if you're on a medically compromising medication, or if you have a high-risk illness, like say uncontrolled diabetes, get a titer to see if you need an additional shot. The complication also, Anna, is if you say you were born between 1958 and 1989, you might have only gotten one shot. And so my advice to you is just go and get a second shot. I'm in that group. I'm going to get an additional shot. If you're 1990 and older or born after 1990, you've likely had two shots. You're good.
Okay, that's really, really helpful information. Doctor, as the nation is facing this public health crisis, NBC is reporting that the newly sworn in Secretary of Health and Human Services, Robert F. Kennedy Jr., a longtime vaccine skeptic, has not visited a number of agencies, has not sent all staff emails to the department's workforce, and has not done anything to address this measles outbreak, according to one department official. Talk about how politics could impact the response and what that means for us.
You know, I'm worried as a physician that what we're seeing is performance politics. We're seeing this in the cancellation of the vaccine committee meetings that are critical. You know, we don't have time to trifle here. If that flu vaccine meeting doesn't get rescheduled quickly, there's a 6-month manufacturing cycle for flu vaccines because we need those updated flu shots that are thoughtfully considered in September. So these things, performance politics is getting in the way of us actually doing things that will keep people out of the hospital. I worry and I empathize with my colleagues that are still in government trying to do the right thing. But yes, this is directly going to impact preparedness. It's going to impact how the WHO and some of our other countries respond in their own regions of the world. So this has broad-based impacts.
Well, I know we will be in close touch because this is a developing situation still. Dr. Vin Gupta, it's good to have you here. Happy Friday, my friend.
Thank you.
Up next.